Hello dear learners, I welcome you all to the today's video lecture on cholinergic drugs, that is parasympathomimetic drugs. In today's video, we are going to cover about the repeatedly asked questions from the cholinergic drugs. So coming towards the repeatedly asked questions or frequently asked questions, here I have enlisted few of the questions which are important from board exam point of view. Now the first question contains, the question is, explain the term cholinergic drugs. That means what are cholinergic drugs, how they affect, what are their actions. So these overall statement, that is cholinergic drugs ka definition we are supposed to write. Then we are supposed to write the synonyms along with the example, and we are supposed to write down the common uses. So it deals with the explaining the term, that is what are cholinergic drugs. This question comes in exam for 3 marks. Sometimes they may ask you for 2 marks also. So this explaining the term question comes generally for 2 marks or 3 marks. Along with combination, some other question may also be asked, or the structure may also be asked for the 3 marks. Then question number 2 is, what are cholinergic antagonists? Give the example and name the drug used in treatment of Parkinsonism. Now here you can see again the question is, explain cholinergic antagonist. So same way cholinergic drugs you are supposed to write about cholinergic antagonist, or they are also called as anticholinergic. So what are they? Unka proper definition, then examples, then name the drug used in treatment of Parkinsonism. Now this is adjoint question to the what are cholinergic antagonist question. So name the drug used in Parkinson's. We are going to see ahead what are the type of questions which are asked. Name the drug used in treatment of this and that. So this question comes for 3 marks. Then coming towards question 3. Question 3 says, define and classify anticholinergic drugs or parasympatholytic drugs with examples. So here anticholinergic classification they are asking. They are not asking about the cholinergic classification. Anticholinergics are also known as parasympatholytics. Lytic means to break down. So since it is anticholinergic classification, so the question is parasympatholytic drugs will also come. So classify and define and classify anticholinergic drugs or parasympatholytic drugs with example will come for 3 marks. Then question number 4, define and classify cholinergic drugs with example. So this question also is asked for 3 marks. Herein you are supposed to write down the classification of cholinergic drugs, or it is parasympathomimetic drugs. That means the effect which is mimicked, means parasympathetic effect is mimicked, so it is parasympathomimetic or cholinergic. Now question number 5 says, 2 complete drugs you have. So the drugs are write the structure, chemical name, properties, uses of neostigmine. And same question is next, write the structure, chemical name, properties, uses of atropine. So these were few of the questions. Now this structure, chemical name, properties, uses, each quality comes for 1 mark. Each parameter is for 1 mark. So since here 4 parameters were there, I have added 4 marks. Now coming towards the next question. The next question says, give the structure of any one acetylcholine esterase inhibitor drug. Now all stigmines are generally acetylcholine esterase inhibitors. So the drug is neostigmine. All stigmines are there. So it is give the structure of any one anticholinesterase inhibitor. That means either neostigmine, pyridostigmine, ribostigmine, whatever you want. What neostigmine, why I have written? Because as you have seen in the earlier slide, the complete question is also asked from the neostigmine. Then next question is, develop a structure and name the drug using following groups. Now here we are supposed to first identify the structure. We are supposed to draw the structure. What are the features we will see? Now the first is dimethyl carbamyl oxy, and second is trimethyl alaninium. So these two features, whatever the drug may be having, so this will go to that drug particularly, means the structure of that drug. So here also you can say the drug that is neostigmine, the answer is neostigmine, and the structure will be developed when you will draw these parts of the structure. So the question comes for 1 marks, drawing the structure. Then question number 9 says, write the uses of pilocarpine, neostigmine, physostigmine, acetylcholine. All these stigmines uses they have asked, neostigmine, physostigmine, then pilocarpine and acetylcholine they have asked. So this question also carries 1 mark each or 2 marks each. So uses of pilocarpine, neostigmine, physostigmine and acetylcholine are important. Then next question is, name the drug used for. Now this is the very famous question which is asked in the exam. Name the drug used for glaucoma. Sometimes they may ask you the drug which is used in glaucoma. Then the examples are pilocarpine, carbachol, physostigmine, etc. Then name the drug used in treatment of myasthenia gravis. In case of myasthenia gravis, neostigmine, physostigmine, etc. And the third disease is Parkinsonism disease. In that the drugs are like carbidopa, levodopa, bipyridine, etc. Now to summarize all the questions, as you all know, the summary like definition and classification I will cover first. So the definition of both cholinergic as well as anticholinergic drugs is important, along with classification of both the classes, cholinergic as well as anticholinergic. Then complete drug, complete drugs, stability, storage, every aspect is asked. The drugs are atropine and neostigmine. So these are the complete drugs from this chapter, and uses of pilocarpine, neostigmine, acetylcholine, physostigmine, etc. Uses you are supposed to write down, and this question will remain common, that is name the drug used for various conditions. So you are supposed to add into it from other chapters also. The same question is really very important. With this we finish with few of the questions from cholinergic drugs. Thank you.